you can't enforce rights that people are not aware of. So the first thing is people need to be aware of their fundamental rights. And so that means that
What is the if it's done right and the act is being enforced the way it should be, what would be the positive impacts of that bill to the Nigerian mental health space? And then we can now move forward to what are the challenges that we face in enforcing that that act, and how what can we do as individuals, as a society, to make sure we address those challenges and put it at the forefront.
okay, sure. So, what are the positive benefits of the new act? I would say that there's really three or four kind of groups. The first is in terms of the new institutions it's created. I've mentioned these before, but let me just reiterate. One, it creates a Department of Mental Health Services, which is really important, that has the power to administer the bill's provisions and really do a lot of the coordination that's necessary to impact the space. It creates a mental health assessment committee that includes psychiatrists, civil society, community healers, legal practitioners, social workers. Supposed to have an appropriate gender balance to enforce the rights of individuals within who are infringed within the Mental Health Act. It also creates a mental health fund. Funding has been a really big challenge. Of it for mental health services and for health in general, right? We only have around 5% of our entire budget that's focused on health. And of that 5%, only around 3 to 4% is focused on mental health. So when we think about it as we think about the right to health, detailing physical, mental, and social areas, right? It's really the right to mental health has been bridged and when we think of the broader context of health. So there's huge financing challenges. Then in the context of human rights, the bill does things like it gives rights in certain social sectors, so like lack of discrimination for housing, employment, legal and medical services. It prevents individuals from it allows individuals to be able to express themselves in care. You had a lot of individuals who would just be treated on. They wouldn't be have their information. They wouldn't be getting any information or access to their opinions. This changes. It holds their right to express themselves, to share their opinions, have right to access information on their treatment. It allows individuals who, if they can't exercise their rights when it comes to their treatment, they can have a legal representative help them in formulating their treatment plan. And then in care, it does things like making sure that the mental health services are integrated at all levels in all levels and public facilities, which is really key because that gets us to some of our community mental health components, making sure that mental health gets to the grassroots. It makes sure that we think about mental health integrated in other disease programs because mental health is something that is comorbid. It is something that is challenged when you're thinking about HIV, AIDS, or reproductive health, or or postpartum depression, right? So we need to integrate mental health services in other disease specific programming. It helps incorporate those with lived experience within the treatment and the support of those who have mental health conditions because we need to think about one to one and people's lived experience is an important testimony of how you can deal and cope with mental health challenges in general, and it makes sure that there's no treatment without prior written consent, which is really key. It's supposed to, in terms of managing mental health, I think finally, this is really key. It helps training and capacity building of those who are dealing with mental health services and individuals so they can de-escalate conflict if somebody's triggered or they're having an episode or they're having a challenge or they're acting a bit robustly and it can potentially cause physical violence. It gives people the tools in terms of de-escalating those crises instead of just beating them and things like that happened in the past. It bans forced seclusion and other methods of restraint because, like people would chain, they would drug, they would have different chemical restraints. It bans all of those things, which I think is really key. It prevents sterilization, which I mentioned before, and this can't be overemphasized because the idea behind of sterilization is the idea that certain genes should not continue, and so those who have mental health conditions should be sterilized because we don't want their genes they're defective and they're devalued, and we don't want them to contaminate future gene pools because they're not worthy of having kids. So early stipulations of the Mental Health Act actually had sterilization of adults, and it just tried to exclude it for kids because they thought that there was a special category. But the idea is this eugenic fantasy of what the ideal able body looks like. It prevents things like sterilization and teaching without following proper guidance, like the National Health Act or the National Code for Health Research Ethics. And then finally, it bans. It has really high penalties for those who are caregivers if they're caught doing any sexual abuse or misconduct for individuals. It gives individuals like a life in prison. Imprisonment if they're caught. So there shouldn't be the sexual exploitation of those who have mental health conditions. And so those are some of the major stipulations and rights. And in terms of enforcement, I think that there's a lot that can be said there. I think part of this is some of the things we said in our mental health 10-point agenda, which I can kind of describe now. The first thing is you can't, and I'll just kind of try to go through the 10 points because I think that they're key in the context of
Yeah.
enforcement. You can't enforce rights that people are not aware of. So the first thing is people need to be aware of their fundamental rights. And so that means that making sure that there's a publicly accessible gazetted mental health act. Right now we have the gazetted mental health act on our act, but people need access to it on trusted government mental health government websites. So that means the Federal Ministry of Health, the National Assembly. If people can't access it, they don't know what the new terrain of rights are, right? So they can't have civil society uphold what the actions and the implementation and provisions of the act are supposed to be. So first, a publicly accessible gazetted mental health act on trusted mental health services. Second is our suicide not crime NG, which is decriminalizing attempted suicide. We have you mentioned it earlier, but essentially the World Health Organization says that if we have people, we right now attempted suicide is a crime according to our criminal penal code. The World Health Organization says that people do not want to share their suicide ideations, their challenges. We don't have doctors who want to share information about their patients, about suicide cases, etc. So we get less data, and people don't want to share the psychological vulnerability. And the very point of the Mental Health Act is to get people the help they need. So we can't have other regulations that contravene, right, are counterproductive to that end. So we need to make sure we decriminalize attempted suicide, which is our Suicide Not Crime NG campaign. Individuals can go on our website and sign a petition. We have thousands of people who have already signed, and your voice can help that. We need the third is that we need the political capital. Without political capital, we wouldn't have gotten the Mental Health Act passed in the first place. And we have a new regime, a new administration. We have the Tinubu for now. We have all the governors at the subnational level. You know, health is a major subnational priority. So we need these new administrations to prioritize whether they're budgeting, their long-term development planning, their medium fiscal term plans, to prioritize mental health and efforts. If we don't have the human capital, the political buy-in, then we won't get the effective implementation of the act. Right? Talk self less of implementation at other levels in terms of the objectives, etc. The fourth is we need money. We don't have you can't if you don't have the finances, you can't have new projects, new programs. You can't finance the important critical, whether it's drugs or psychosocial support that's needed. We have the challenge right now is that we there's not a lot of money, and the money that we have is geared towards psychiatric hospitals and drugs, and we need to do more than that. We don't even have, and mental health care needs to come up with larger increases just in the health budget, because we've committed to the budget cords of having 15% for health budgeting, but like I said, we have around 5%, which is really paltry, and we need to do more. Nothing about us without us is the fifth implementation target, which means that we need folks who are talking about implementing the Mental Health Act who have mental health condition, because they can talk about, and their representative institutions. So we need persons with disabilities, civil society, persons who have mental health conditions to be part of the table. We shouldn't have people legislating on individuals with mental health conditions without incorporating their key voices. Six, we need to include diverse factors in this. So right now there's a psychological bill, which doesn't really make any sense, because that psychological bill, which is pending passage, could have been incorporated in things like the Mental Health Act, right? So how do we make sure that psychologists, lay counselors, lawyers, et cetera, are part of the conversation going forward in the future. We need to uphold all voices in all professional fields because all of these individuals are key parts of the conversation to support and advance mental health. The seventh is mainstream psychosocial support. We have nearly 100% of the funding for mental health go towards what I would call biomedical, which thinks of mental health as a disease that needs to be just treated with drugs or confined versus psychosocial support. Like I said, art, social groups, what I mean, radiotherapy, apps, etc. That all the different types of things that you can do in terms of mainstreaming psychosocial support. So we need to increase funding for that as a percentage of the mental health budget. We need to define clear metrics of act success. So what does it mean that we have a mental health act? How do we know we're being effective? We may know that we're being effective if we're getting more data when it comes to suicide rates and depression. If we're decreasing, if suicide rates are decreasing, if more people have the ability the tools to talk about mental health with individuals who have other types of physical disability, right? So a psychologist, psychiatrists are trained in basic ways that they can engage with individuals, right? More people are trained on first response. So there's a lot of ways we need to define the clear ways to say in a year or 2 years, this act has been effective and this is why. Or mainstreaming other accommodations that need to happen, whether in electoral services, in civic space, or public institutions. We need to include mental health in primary healthcare centers. Right now, you can go to a primary healthcare center, you can get your malaria test, you can get your typhoid test. You can't get a lot of mental health support, all right? But people who are facing mental health challenges, they're in the grassroots, they're in the rural areas, they're in the last mile. So we need to make sure that we can mainstream mental health services and some basic trainings at that level to people to provide support for individuals, who can't access it all over the country. And then finally, we need to make sure that states are on board. We only have two states that have mental health acts. That's Ekiti and Lagos. But we need to domesticate that across the board, across the country. So the 10th and finally is domestication of the Mental Health Act. So states really play a key part in mental health recovery, support, and advancement at the subnational level.
Yeah, all those is very, very, very important. And like always, I would leave links to your website and links to how people can actually read about these things on their own to further educate themselves and also find ways to support what you guys are doing because it's really, really amazing. And it should be what we are all doing as a society, not just what is left to one organization or to a bunch of organizations.